Myself is Dr. Pradeep Kumar Goswami. I am a consultant gynecologist and obstetrician and a subspecialist in fetal and maternal medicine. I am the founder and director of Fitomat Foundation and the lead consultant in this team. Well, when a sad thing like a miscarriage happens or what we call as intrauterine fetal death, that means the baby dies inside the mother's uterus, a sincere effort is necessary to find out the cause. If it happens early, like a miscarriage before 24 weeks of pregnancy or 6 months of pregnancy, the causes may be many, and in spite of all the investigations, actual cause may not be found, the case we call as the unexplained pregnancy loss group. But roughly speaking, some tests of the mother in terms of the mother's blood is necessary, assessment of womb or uterine conditions, assessment of the ovary, the assessment of pregnancy hormones, these are all important, However, one of the most important assessment, which is the product of conception or the dead pregnancy tissues, should be assessed for chromosomal or genetic problem. And the science has improved or modified quite a bit in this field, and we have tests available in now which is called as the molecular karyotyping of the fetus, which assesses the baby's genes in details, the chromosomes in details, to give us a possible association with the pregnancy loss in the fetus, and therefore link or attempt to solve those problems in next pregnancy should be count. It is called as the molecular karyotyping or what we call as a Karyolite-Bobs test, and these things can also be done on fetal tissues like the fetal skin, the placental tissues and things like that. Sometimes when this unfortunate event happens, the fetal medicine people recommends the store this fetal tissue, a little bit portion of the fetal tissue as fetal DNA, and therefore when the mother and the father settles, the parent settles after this sad demise of their prospective child, genetic counseling is arranged, and depending on the advice of the genetic counselor, further assessment of those fetal DNA is possible to find out an association or rule out any particular problems which may recur in next pregnancy.